Welcome back. Treatment for cancer patients during this pandemic has in some cases been put on hold, but at Texas Oncology's Center for Proton Therapy, they are taking steps to continue helping patients who make up part of the vulnerable population that we really do need to protect. Joining me now via Skype is Dr. Andrew Lee, Medical Director of Texas Center for Proton Therapy. Thank you, Dr. Lee, for being here with us. So last week, restrictions eased for elective procedures, which includes screening. So what are patients able to come in for at this point?
So it varies depending on the center. Certainly at our center, we still offer patients an opportunity to have laboratory studies done if they need any imaging studies done, such as an MRI, a CAT scan, or a PET CT. We're able to accomplish that. And if they're appropriate candidates, obviously proton therapy, which is a unique form of radiation therapy.
And aside from coming in for an appointment, I know that your staff is using telemedicine. So what remote services can you offer during this time?
Yes, absolutely. So we've been employing telemedicine for almost 4 years at our center. And what it does provide an opportunity to do is bridge services without the patient having to actually come in physically to our center. And as you can imagine, for cancer patients during the pandemic, it's a very anxiety-provoking time, because not only are they facing the risk of an infection, but they're also trying to get their cancer addressed at the same time. And so telemedicine via two-way secure video and audio communication affords us an ability to do several things. One, we can assess the patient and also to evaluate whether or not their cancer needs to be treated right away, whether it could be delayed for a significant period of time, or if they're kind of following in the middle group, and we can counsel the patient regarding the risk of delaying their treatment versus the risk of exposure.
And since we're talking about this vulnerable population, who should be coming into the doctor's office and who shouldn't be?
Well, in terms of for cancer patients, what I would recommend is that the patient reach out to the oncologist directly. For example, for our patients, we try and triage the cases. We try and get all the information up front so we can make a determination on how best to serve that patient. And oftentimes the telemedicine visit can serve as a bridge to determine whether or not the patient needs to come in for extra studies, or maybe actually for a physical exam or a special endoscopic procedure. Or if we feel that they can delay several weeks, if not months in some cases. And so really it has to be addressed on a case-by-case basis.
So what are some of the examples of those cases that can be delayed, or the non-urgent appointments?
For the probably for several common diagnoses include things like certain breast cancers and certain prostate cancers. I wouldn't say universally that all of those can be delayed, but in some of those cases, the cancers can be relatively slow growing, so that can be one factor. The other factor is that sometimes there's mitigating therapy that can be administered before the patient needs to have something like proton therapy. In the case of prostate cancer, oftentimes patients need to be treated with hormone therapy because of their diagnosis, and that certainly can be started in the upfront setting. While we kind of wait for the curve to flatten out a bit more and the patient can actually come in for their actual proton treatments.
I've gotten a lot of questions from patients who may be in remission, or they're a caretaker for someone in remission. How concerned should survivors be about the threat of contracting COVID-19? And at what point, sort of post-treatment, if ever, are their underlying health issues maybe less of a concern?
Yes, so that's a good question. Certainly, depending on the case, there can be some level of some patients that are immunocompromised because of their therapy. And so again, it's really on a case-by-case basis. There are going to be some patients that are in remission from their cancer that probably don't have any significant risk beyond what the general population would have. Other patients, for example, if they received high-dose chemotherapy or a stem cell transplant, they probably have to exercise extra precautions. And that often can be determined with either some laboratory tests or a phone call with your physician. And so I would encourage every patient to, if they're concerned about it, to reach out to their treating oncologist.
Okay, I know that that's going to be helpful information and sort of offer relief to a lot of people. Dr. Andrew Lee, thank you so much for your time.
My pleasure. Thank you.
Dr. Lee, thank you. And we want to salute our healthcare heroes as well this